Again, welcome to another episode of the Rotator Expert. Today we're going to talk about the 10 things you should not do after shoulder surgery, the mistakes that you can make that we do not want you to make because we want you to recover well. As you know, I'm Dr. Daniel Orcutt. I'm an orthopedic surgeon. I've performed and helped thousands of people recover from shoulder injury and shoulder surgery. So I'm here to help. I'm here to give you some information, hopefully some empathy, a little bit of comedy maybe, in helping you recover from your surgery. So if you're dealing with pain or you're prepping for surgery or you're recovering, I'm going to break this all down for you so you know as much as you can. I'll have no fluff, no scare tactics, just real expert advice to help you heal harder, to help you heal smarter. So let's dive in, right? In the comments, tell me what's been the hardest habit to break since you have surgery. Or did you not have a habit? Or did you create a habit after surgery that you need to break now? I know there's lots of things with the stress. Sometimes we add some habits that maybe are not so good for us just to get us through the recovery. So let me know in the comments below. All right, mistake number one, doing too much too soon, right? So there's certain people are more apt to do this than others. Some people, we can happen on both ways, both sides. So between usually week 2 and week 6, or people will begin to feel a little bit better, and they try to maybe they're overreaching or lifting too much or doing housework or do those things that if you do those too soon, you may trigger a setback, right? Especially risky if you had a rotator cuff repair or a labral repair, because those things need time to heal. So it takes about 6 weeks for us to get some healing, and then it takes at least another 6 weeks, about 3 months, to get to more complete healing. So if you're doing something in between, you could jeopardize your recovery. So just because you can do it doesn't mean you should do it. And just because you did it once doesn't mean it's safe for you to do it again. So once might be okay, twice might be the thing falling apart. So be careful with that. All right, mistake 2, skipping or rushing physical therapy. So we don't want to miss PT, right? We want to be there, but we also don't want to rush PT, right? So we don't want to be doing too much. We want to be consistent, not necessarily intense, but consistent. The at-home exercises, specifically that what your therapist shows you or tells you to do, we have to be careful with. That was my dog, but I'm sure we're going to get this corrected in just a moment. So if we rush PT, we're going to cause an inflammatory flare-up, and we can cause more pain and more difficulty in recovery, right? So we want to make sure when we do our home exercise program that we're not doing too much, that we're doing what the program says to do, right? If it says 3 sets of 15 repetitions, then that's what we need, is 3 sets of 15 repetitions. If we do 6 sets of 20 repetitions, that's not what the therapist says. So we need to be careful. Physical therapy is important, but we also don't need to overdo it, right? So we have to be really careful with what we're doing and keep with the protocol. Mistake number 3, wearing the sling incorrectly. So the sling protects us. However, the sling is uncomfortable. We know that. It helps us support us, but also is restrictive. No one likes the sling, but we need to make sure we're wearing the sling when we need to, because we don't want to skip it early and then cause a strain by again. It reminds us not to stretch, reminds us not to lift too much. It also reminds people around us not to touch the arm, usually. So that's important. So the tricks of the sling, right? Often put another pad here that help protect so it's not so irritated. You might need a little towel underneath the elbow if you don't have the spacer there. Again, the sling isn't a crutch, it's a safety net. So we need to be careful. So make sure you wear your sling until you are allowed to not wear your sling. Okay, mistake number 4, managing pain. Skipping pain meds can create spikes. And if you get a spike of pain, you're going to contract, muscle guarding, muscle spasm, poor movement, and then we're going to maybe fall behind. I understand we are in this world of protection and concern about narcotics. However, this is the time that narcotics are often needed to allow you to recover the way you want to recover. So consider anti-inflammatories or the supplement support at night to help decrease the inflammation. As you know, again, we have this, our shoulder supplement. We'll link to the show notes. It's a good anti-inflammatory. It's easier on your stomach, especially if you're worried about the stomach stuff that you're having with other things you're putting into your body, other medicine you're putting in your body. So we need to manage pain. Manage pain is not weakness, it's a strategy. We need to make sure we manage pain so we can do the things we need to do to progress in our recovery. Okay, so I hope you like this video. I hope this video is helping. If it is, please subscribe. Please like this video. You know, we come here every week with another video trying to bring knowledge and comfort and a little bit of humor. So please subscribe to the video. Also, we have a free pre-op checklist down below. So if you go into the description and click on the link, we will give you the free pre-op checklist. I'll try to say that better. Okay, mistake number 5, ignoring the post-op instructions. So the post-op instructions are there for a reason, right? Your doctor did the surgery, and now they will tell you what they think you should or shouldn't do. We need to make sure we're following those instructions. They're not suggestions, right? They're actually instructions, and they're carefully timed and protocols, right? We have protocols of what to do week 1, week 2, week 3, week 4, week 5. So if you have limits on how much you lift or when you should shower or how long you should use a sling, they all deserve a responsibility for you to hold them, right? I feel fine is not the same thing as healed, right? So we need to make sure we're holding ourselves accountable to that. Your body needs time. Even if your mind is ready to go, your body may not be ready to really go, right? So mistake number 6, sleeping without support. Now, this is a mistake you'll make probably once, because if you try to sleep flat with your arm in extension, you're going to put stress on the shoulder and it's not going to be comfortable. So make sure early on you're wearing your sling, maybe even the pillow in between there. We do the wedge so you're sitting up. We put a little pillows around it. Again, maybe a bed rail to help protect your body, protect yourself. So that's important. So your shoulder needs rest and it needs safe rest. It needs support. So making sure you do this is important, especially when you're sleeping. Okay. Mistake number 7, delaying shoulder movement, right? So this is akin to the first thing about as far as making sure that you're doing therapy. It is important to do therapy. If you do not do therapy, if you decide not to show up, if you decide you don't think that the doctor knows what they're doing, you're hurting too much, you're not going to move, that is a big problem. Because if you get stiff, then you have another problem. So now you have a shoulder surgery, and then you have shoulder surgery plus stiffness, then it's going to be even harder to recover. So make sure you always go by your surgeon's protocol, but don't avoid movement out of fear, right? If you're really worried, call the doctor, get in sooner, have them take a look at you. But oftentimes, early safe motion is recovery insurance. It's important. Or we say motion is lotion. Moving that arm, even if it's not very much, even if it's just little pendulums, it's important to get the shoulder moving so you don't get stuck behind, right? Okay, mistake number 8, driving too soon. I've heard this a million times. I can drive with one arm, one hand. I know we all can drive with one hand, but we always have another hand to support. Just because you can drive doesn't mean you're mentally ready to drive. Most people won't be cleared for driving for about 4 to at least 6 weeks typically. So it's a big deal. You can't drive with a sling on. That's a big deal if you get in an accident and the cop comes around and sees you with a sling. That's not going to be good for you. So I understand you think you can drive with one hand, and you probably can. However, we always have two. And technically, our driving test does not say we drive with one hand. It says we're driving with two hands. Okay. Last thing, the mistake number 9, smoking and alcohol, right? So smoking is key because it decreases the blood flow. It contracts blood vessels, nicotine. So whether it's smoking or the Zyn patches or whatever they're called, or the chewing tobacco or anything, vaping, right? That decreases that blood flow and that delays healing. So the last thing you want to do is delay healing into something that already has a hard time healing. So be careful with that. With the nicotine, talk with your doctor before surgery. There's things that we can do to help prevent that or minimize the amount of nicotine used is going to be important. All right. And lastly, also alcohol. We do not want to drink alcohol in the recovery time because we don't know how the alcohol is going to react with the pain medicine you're taking. We're also probably already a little unstable just because of our injury and not sleeping well. And we add alcohol to our pain medicine. That's a recipe for disaster. So be really careful, right? So Be careful in the recovery to minimize the risk of injuring yourself because of not being 100% control of your faculties. Many patients feel these things don't matter, but they do. It's my dog again. I think he's got to go out. So we're almost done. We're almost done, Forrest. We're almost done. All right. Don't undo your surgery with your habits, right? Last thing, mistake number 10, skipping follow-up appointments. Skipping follow-up is super important. We need to know where you are on your journey. And if you don't go to your follow-ups, we won't know where you are. That's follow-ups to your therapist, and that's follow-ups with your doctor. Because you might be behind, or you might be, there might be some things we need to tweak to make your shoulder recovery better. The shoulder recovery isn't static, it evolves. So if we can intervene early when there's issues, hopefully that prevents fewer longer-term problems. So every follow-up is a chance to correct course, because sometimes we need to correct course. So thank you all for listening. I know this is probably a longer one, but important. So avoid these 10 mistakes, and you can save weeks or even months from your recovery in just a general frustration. Healing isn't about doing the right thing. It's about not doing the wrong things. So hopefully this helps. We're going to have the video of the 5 truths of the first 6 weeks. It'll be right here in your video. Click on that. Don't forget to check on the link to get the pre-op checklist. And also any comments would be appreciated. And we will see you next time.